The Lifestyle Show, presented by Selina MacKenzie.
And it's time to go over to our very own Prince Charming now, Dr. Pedro. Oh, I've got to say it right. Hang on. Dr. Pedro Palenzuela. Correct?
Yes, very good. Yeah, that was way better.
I'm getting better every time. How are you? Are you okay?
Yeah, I'm really, really good. The hot weather has not been so bad on me.
Oh, you're probably really, used to it. Yeah, we're all good here too. Well, we're going to talk about prostate cancer today, and I think, as we all know, early detection is key. But I wanted to ask you first of all, Dr. Pedro, what exactly is the prostate?
The prostate, it's a gland that it's allocated to make like a map in your mind, right behind your penis. Like your penis is anchored to your pelvis. So right at the end of it, right under your bladder, you will find the prostate gland. That it's a gland that has many different functions, but especially it's to help you produce the different substances you need for proper reproductive function. And actually the urethra goes through the prostate. It goes within the gland. So that's how, when we have fluctuations or difficulties that have to do with our urine, that it's telling us that something with the prostate gland is not going right. So the location, it's really important to know where it is. So it was a really good question.
So would that be one of the first signs if you're having problems urinating or maybe going too often? Is that one of the signs to look out for?
Yes, it's not so these signs can point out to difficulties with the prostate gland, whether it's hyperbenign, like hypergrowth of the prostate, which is the most common thing that can happen. But also prostate cancer can have these symptoms because in the end, it's a growth of the gland. So whether it's what we call a occupant lesion, that's we call in medical terms, which means if the prostate grows, whether it's because it's a benign thing that can happen or it's because of cancer, then the flow of urine will be probably interfered or altered somehow.
Right.
So we can have, as you said, frequent urination even at night, also like a weak flow of urine or interrupted flow. Sometimes also pain or itchiness when peeing. These symptoms can also be due to other stuff, but when we have these symptoms, it's good to go to the doctor and get a check on what's happening there.
What about blood in the urine? I'm guessing you should get that checked out no matter what.
Yes, no matter what. It can be either due to urinary tract infections that are really common. It can be also blood, whether it's on the urine or on the semen, on the seminal liquid. So when you have blood in places where you should not have blood, go to the doctor. It doesn't mean that because there's blood in your urine or your semen, you have prostate cancer, but you need to go and have it checked out.
Yeah, absolutely. So you've gone off to the doctors because you've got a couple of symptoms. How does the doctor do a test to see if it's prostate cancer?
The first thing that we would do, if it depends on the symptoms, but first we will rule out like a general blood test in which we will include the PSA, the PSA, sorry.
Yeah, that's okay.
PSA in English, yeah. So that's the marker specific to the prostate. It's telling us the size of the prostate. It doesn't mean that a high PSA is directly prostate cancer. It tells us that the size of the prostate is bigger and that we have to take a look into it. Okay. So then we'll have to go to either physical examinations, the so feared rectal exam, which usually it's not as common now as it was before because there are other tests we do and other clinical things we have into consideration, but it's actually one of the easiest, less invasive procedures we can do, because actually there's no harm. And through touch, we can understand what's happening in the prostate, because when the touch of the prostate changes, that is giving us ideas of what can happen.
Right. And I know it's quite prevalent in older men. I mean, I know that my dad's had prostate cancer for quite a while now, but it's something that is very manageable and you can live with it. Is that the same for younger men?
In general, with cancerous procedures, the younger one is, the more active the cancer is going to be. Because in the end, the cancer is like a group of, let's say we could call it rebel cells that want to grow, and they grow uncontrollably. So if you have a lot of, let's say, energy reservoir in your body, that happens, the younger you are, the more energy you have, they tend to grow faster and bigger. It doesn't mean that because I've gotten a diagnosis with 50, doesn't mean it's like a death sentence. It means that maybe it's going to progress faster. There's other things that have to do with the growth and the progression of it rather than age. Age is one of them, but it's also like the food that we eat. Foods high in sugar, they are literally like the gas for cancerous cell. So if we are used to having a lot of produced foods and with high content of added sugar, that's going to give the cancerous cells what they want. So rather than age, which is an important factor, there's other things that we have to take into consideration as well that can be as important or sometimes even more, because they add on to each other.
And is there a cure for it, Dr. Pedro, or is it just management once you have it?
Yeah, actually, it's the most cancer amongst men, yet it has a really, really high healing rate, because more often than not, either with radiotherapy or small surgery, because since it's diagnosed early most of the times, and it's not a really rapid progression, you can get to quite manageable and easy solutions without having a really big impact on the person's life when it's catched on time, which usually happens because there's a lot of awareness around it, and the test to diagnosis are pretty easy. And at least in Spain, when you're over 50, everyone gets the pre-evaluation tests to see how the PSA level is going. So it works really good treatment. And as you said, it can happen that when it's really, really small and there's really like no worries about progression that has also to do with age, sometimes there's no need for treatment, because the treatment could be worse than actually just leaving it there, because maybe it won't grow. It can happen. Yeah. Mostly on older people, that there's nothing you don't have to worry about it. Just check it regularly.
Yeah. Dad's having hormone therapy, which I think is probably one of the easiest.
Yes. Yeah, we could say it's the least invasive in terms of it affects your life the least, and you don't have to go through a procedure of getting to the hospital, getting a surgery. So there's a lot of different options, and they tend to go quite good if the diagnosis has been early diagnosis.
Okay. And you mentioned here in Spain about the screening. Should men go every year to be screened over the age of 50?
Yes, it depends. If you've had people in your family that have had early diagnosis of prostate cancer, I mean early when they are diagnosed before 65 years of age, then when you're around your 40s, you should go and get checked and talk to your doctor about your family history on the people who have this kind of cancer. And then you will start getting it around your 40s. And then after your 50s, you should get your PSA tested once a year, the same as you do your yearly blood tests, you include the PSA.
Yeah.
It's done usually here in Spain directly by your GP.
Yeah. Simple, isn't it? Simple and quick.
Yeah. Quite simple.
So it is hereditary then?
It's not that it's like directly hereditary, but you have, let's say, like you have more chance of getting it because it has everything, every physical trait or any illness, it has a component of genetics, but it's not, for example, as we have some specific mutations of breast cancer that have a really high hereditary component. In this case, it's simply that if a few of your family members have had prostate cancer on an early age, it's more likely that you will have it, but it's not like a direct gene like BRCA in breast cancer, for example. So if your father or your uncle had prostate cancer, let's say 70 years old, you should not be scared that I'm going to get it for sure.
Right, that's good to know. We've just had a WhatsApp in from a gentleman who says he wants to remain anonymous, which is fine. And he says, I am a man of colour. Is it true that black men are at higher risk of prostate cancer?
Yes, that was a really good question.
Wow.
I'm really glad they asked that. Actually, that's it. That's true because of the different genetics differences, like small things in the genes. And because of the studies shown that black men are prone to have prostate cancer and on earlier ages. So yeah, on black men, they should all get tested yearly, like those screening tests when they are 45 and on. So it's a higher risk for them.
Excellent. Well, hopefully that helped. It's a fascinating subject and a very important one. If any of our listeners want to find out more, they can go to prostatecanceruk.org. Or, Dr. Pedro, what are your contact details?
Yeah, I think in some of your social media they have my name, which because my surname it's sometimes difficult to understand, and mostly for English speakers. But if they go to Dr. Palenzuela Sexología, so if they find my surname and they search for my surname plus sexology, they will find me on Google. And also if they can find my personal phone number, I can give it. It's +34, Spanish code, and then it's 684 70 29 56.
Brilliant. And if anybody was driving, I have it. Don't crash your car. Just wait till you pull up and I'll give it to you. Let me know. So, chaps, it is very important to get tested, get screened. Don't be afraid. And thank you, Dr. Pedro, once again for joining us. Very informative.
Thank you very much for having me here. I'm really glad to be here and spreading awareness on this and sharing some ease and not to be too worried when there's no need.
Yes, absolutely. Well said. Have a lovely weekend, Dr. Pedro. Bye for now.